Welcome to Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and General Surgeon here at Conneaut Medical Center. Dr. B, a little snowy out. It wasn't snowing last week when we did this show.
No, well, we've had winter arrive, I think.
Yeah, we're supposed to get some more this week.
Yeah,
And,
have you heard? Is there supposed to be a storm tomorrow?
There is.
Yes,
Starting
start
tonight.
tonight.
Tonight into
Up
Friday
to
morning.
possibly 18 inches more.
No, not here. That's in Pennsylvania.
18 inches.
See.
Well, hopefully we don't have a repeat out on 990.
I know, that was terrible. That was
Unbelievable.
terrible. Yeah.
Yeah.
I see we have Denise here with us today, Doc.
I can't believe it's that time of year already.
I know. I feel like I was just here. It was a year ago.
It's just amazing. Well, Denise is going to give a sort of a recap of what's going on at our hospital and in our medical community over the past year, and maybe just a couple of little things
Yeah.
about what might happen in 2017.
All right.
But it has been quite a year for us.
It has been, and that's I bring my notes with me because there's so many great things that have happened. I hate to miss anything,
Sure,
so I've
sure.
got my notes. But couple exciting things that have happened, improvements that we've had in our radiology or diagnostic imaging department this year. Some of you may recall kind of towards the end of 2015, we were installing a new 64-slice CT scanner, which has increased our capability for better images in radiology. So that's been completely up and running. One of the exciting things that happened in September of this year was we brought 3D mammography, otherwise known as tomosynthesis, here to Conneaut, as well as our sister hospital in Geneva.
That is a very big deal.
Yeah,
That's
it is.
a big deal. Much more accurate
Yeah.
imaging in terms of monitoring and prevention of breast cancer.
Right. So UH as a system was the very first system to bring it to Northeastern Ohio. We are still the only two hospitals, Conneaut and Geneva, in Ashtabula County to offer 3D imaging. And that will detect cancers 41% more accurately than your regular screening. And also it has decreased the number of callbacks for like things that you may, suspicious spots by 15%.
Let's let the public kind of think about that for a second. 41%. All right, that means that. I mean, why do you go get a mammogram? Well, because you're concerned about possibly the development of breast cancer, and you want to prevent it or find it early enough so that it's curable. And you go in to get your imaging study, and now all of a sudden, your imaging study is almost half again as accurate as it was before. So you have to kind of think about that. You have to think about UH being willing to bring that into our community. And you want to think about getting the best study that you possibly can, so that it achieves its purpose. And this business about callbacks, everybody knows, or a lot of people I would think know how stressful that is.
Right.
When you get a call from the radiologist that you need another study. Oh boy! I mean, immediately it's like, oh no, now what?
Right.
And if we have technology that can reduce the number of people who have to go through that, that's a real plus for our town, for our community.
Definitely. One of the things we do know, as this is new technology, we do know that not all insurance companies yet recognize that as a means for screening. They still rely on the other normal screening with the 2D, which is perfectly fine. It's still, you're not going to not detect something. Insurance companies that we do know that currently will cover it are Medicare and Medicaid. Apex and Aetna will cover that. More insurance companies are getting on the wagon with it. We do encourage anybody, if you are interested in, or if you talk to your physician and they're ordering a mammogram for you and you're interested in getting the tomosynthesis or the 3D, we encourage you to go ahead and contact your insurance company ahead of time, and they will let you know that if it is covered, fantastic. If it is not, they'll let you know that how much you will probably have to pay out of pocket, and we're finding it averages about $150 out of pocket.
Tomosynthesis 3D. And folks, this is another example of how it is in your interest to be informed. See, that's empowerment. We talk about that on this show a lot. If you know what to ask for, and you know that you can personally call your insurance company and find these things out yourself, and take the lead in that, that gives you more control over what happens to you.
Right.
This is what we want.
Right. So that was definitely a fantastic enhancement. We've been waiting for that to come, so we are very pleased. The procedure actually, the exam itself is actually identical. I was one of the first to test out the new system when we brought it here into the hospital, just so I have a good understanding of how it works. So the screening is exactly the same. What has changed is the software. So, so same type of screening, takes the same amount of time. Very important. Some of you that may have been in the hospital lately, maybe you've walked, you've come in the main lobby, you've walked either over to the emergency room, or maybe you've gone to radiology, to the cafe up to visit someone. You may have noticed some construction at the end of the hall on the first floor by the elevators. That is going to be our new Harrington Heart and Vascular Institute. And so what we're doing is building a dedicated space where patients can now come and see your cardiologist. You can get any of your stress testing done you need to have. Everything will be done in that same space.
So people aren't going to have to run all over the place.
Not going to go to the second floor, down to the first floor, over to here, over to there. Yeah, so we'll have it all in the same location. That is slated to open in January of 2017. Construction's pretty much done. It looks very nice in there.
Can you explain to the public that term Harrington, what that means to our community?
Well, Harrington is actually there was an endowment. It was a donation that was made.
But I mean, that's the name of the big institute within UH.
Right, so all of the cardiologists that work out here, and even many of you might be familiar with Cindy McKinley, who runs our cardiology rehab. She is trained also through Harrington Heart and Vascular, which is Cleveland main campus. That is what all of the physicians are trained under, the Harrington Heart and Vascular program.
So the benchmarks for our service out here at Conneaut are set at the main institute, and we are practicing up to those benchmarks.
Right. Yeah, both of our cardiologists out here, Dr. Osman and Dr. Bonatti, both do work as well downtown at Cleveland. Dr. Bonatti works particularly a lot with heart failure cases, and Dr. Osman does a lot of innovative, non-invasive approaches to heart care as well down there. So they bring that same care out here to our patients in Conneaut.
I know them both. I mean, they're great guys.
Yeah. So that's we're very excited. We're making what we feel are very, very worthwhile investments in our infrastructure and our technology here in this hospital, and we're getting it to where it would be the same type of technology you would do if you went downtown, and you don't have to go downtown. So that's really the exciting piece.
That's huge for our town.
Yeah. Let's see, what else? A couple of reminders just to, towards the end of last year, our emergency room received Rainbow Baby and Children's Hospital designation. So everyone who works in the emergency department here at Conneaut, as well in Geneva, are trained specifically on protocols to treat pediatrics and treat children, the same type of care that you would get if you took your child to the emergency room at Rainbow Babies and Children in downtown Cleveland. Same exact protocols. And we do receive surprise visits from Rainbow periodically to make sure that we're still following those exact protocols. So that's, exciting to know that you can take your children here and get that same treatment.
That's got to give the people in our town a lot of confidence.
Oh yeah, especially approaching winter. You don't want to have, if something's wrong with your child, you don't want to have to drive far. You don't want to have that, you don't want to battle the snow and the ice and the sleet and whatever else may happen, and you're scared and you're frightened. You want to get the best care you can right away, and we're bringing that here. So
Excellent.
A part of that actually is we are pleased that we have been designated this year as a 4-star facility by the Centers of Medicare and Medicaid for quality and patient experience. And that is, those are not things that are self-reported to Medicare and Medicaid. Those are things that patients have experienced in the input and our quality scores that we receive from patients that have been here, and that's how that's all calculated. It's a very, if you really want to dig deep, you can go on the CMS website under the hospital compare ratings, and it's listed right there that we are a 4-star hospital. And
So this isn't some capricious thing. I
No.
mean, this is because of hard data
Exactly.
that's collected and critically evaluated.
you can dig deep into every single piece of that on the website if you are interested, and there are people who do statistics.
Sure, sure.
So we are incredibly proud of that.
Took a lot of work to get that.
Oh, it does take a lot, and it continues to take a lot of work. That'll change. That reporting changes kind of every quarter, and to be able to maintain that level consistently quarter after quarter
Yeah.
really shows that you have your patients' safety and health and quality in mind. The other thing, the urgent care, I just want to remind everybody too, because that kind of came on towards the very end of last year, beginning of 2016. Our urgent care is available 7 days a week now. They are open from 10 to 7 every day, staffed by people who also staff emergency rooms. So when you come to our emergency room, you come to the main window. And from there, you're assessed and decide, and there's a protocol that'll help you help the staff decide, should you go to the emergency room or can you see the urgent care? One of the great benefits to that is, I don't know about you, but my copay to go to the emergency room is significantly higher than it is to go to an urgent care. So if I'm struggling with a really bad sore throat, or if I've spiked a fever, or my child has spiked a fever, and maybe they really don't need emergency medicine, which is, a lot of times we think of as cardiology and things that are, life-threatening, then, they can get that same care at the urgent care for a lot less than they'd have to pay. So
Is that located right here?
it's right next to so you would go to the emergency room window.
Right.
And the urgent care is just around the hall from the emergency room, but they assess your situation right there at the window based on the questions that you answer, and then their discussion with
And then you come in and you either go here or there.
Yeah,
I guess I didn't know that. I didn't
Yeah.
realize it was based right out of the hospital.
right, it is.
Yeah, it's
it is.
real, there's a UH urgent care in Ashtabula.
Okay.
Which is not attached to the
Which
hospital,
is
obviously.
freestanding,
Mm-hmm.
but this one here is,
Yeah.
and, it's very flexible and very responsive, and people they can sort of have it both ways, really. Meaning that they come and it turns out that it's an urgent care kind of a situation, and so they save all that money, okay? But then they get in there and the evaluation starts, and perhaps something comes to light that is a bit more serious than was originally anticipated.
Mhm.
Well, the entire ER staff is right there.
Right,
Right.
So there's
right.
no delay,
right.
That's excellent.
I mean, that really, it's looking after your pocketbook, but it's also looking after your safety. It's a really nice model.
One of the other important pieces to that too is, should you have to visit either the emergency room or the urgent care here at UH, your UH physicians will be able to see firsthand electronically through your health record any blood work that you had to have done, any radiology tests you had to have done, any antibiotics, any medications they might have put you on. And there's that seamless care between
So
your
important.
primary care doctor and what you may have had to have done while you were here in the hospital.
Absolutely, that's so important.
Yeah.
That means that when your doc finds out what's going on, you're not going to have the same tests all over again because they're already done.
Right,
And there's not any delay at all in knowing the results.
right.
So
Yeah,
if-
so that's really important.
Yeah.
Let me see, so last week, I believe you had on here, somebody new from speech therapy, correct?
Mhm.
That's right.
Okay.
Olivia. Falco.
Olivia, okay.
Olivia
So
was-
that was another service I was just gonna touch on, but you folks have already met Olivia. But speech therapy for both adults and children is something that we've worked quite a while getting somebody here in the hospital to take care of, so.
Well, I think it's important to emphasize that this is a very new service. that it was the culmination of a great deal of effort to bring it here and get it set up.
Yes.
And that it is available in our hospital. And Olivia really did a very fine job last week.
She did.
And illustrated that this is important and is a source of very meaningful intervention and reassurance in children,
Mm-hmm.
as well as adults with swallowing problems.
Right.
So that was covered, and I don't think it hurts at all to emphasize again that service is now available here.
Right. The other piece that happened last year, and there really wasn't a whole lot of talk about it, or there was no really big press on it, but something important to know is our Ohio Bone and Joint Institute that's here in the hospital where we do all of our orthopedic work, was actually selected as a center of excellence by General Electric. And what General Electric does is it's a very rigorous process that you go through, and GE likes to pick centers of excellence across the country to help treat their employees across the United States. And it has to be the best possible care for their employees. And being designated to that was really, really important to us. There are only 3 other orthopedic centers in the entire country that GE trusts to send their patients to, and Ohio Bone and Joint here in Conneaut's one of them.
Can you imagine
Isn't
that?
That's excellent.
In
Yeah.
the whole country,
In the whole country.
here at Conneaut.
Right. So I just wanted to, that's kind of an accolade that
Well,
we're pretty modest about this stuff. We really don't.
well, but the thing of it is, people know Bill Seats, that's his baby, and Bill does a fantastic job. But there's another piece to that.
Oh, yeah.
And that's the hospital.
And-
That's the medical staff that takes care of these patients medically. That's the OR staff. That's the aftercare staff on OBGYN. I mean, so it's a team.
Oh, definitely.
Bill's the captain of the team, and Bill's the
Yeah.
surgeon, and he does a great job.
Yeah.
It is a team.
Yeah, I've seen the nurses working with, and physical therapy working with the joint replacement patients in that hallway, the day after their surgery. And they're just some of the best caring people that you'll ever come across, so.
I see patients in my office, and they may have had an experience at OBGYN, and it's like they can't believe the care they got, and how nice everybody was. And, yeah.
I've had people say it's like going to a spa. Honestly, I have. So I don't know. I don't want to find out firsthand, so I'll just take their word for
Nobody
it.
But if it comes to that, it's
Yeah.
nice to know.
Yeah. And then some exciting physician news. We've got some new physicians that Dr. Bryant, fortunately, he has the opportunity to, before we bring any doctors in, Dr. Bryant is one of those physicians that sits down and has a chance to talk to each and every one of them, to let them know, kind of, here's our standards that we have in this community. We'd love to have you, but this is what our expectation is. So we do have new physicians here. The first one I'm going to mention is Dr. Brenda Beck. She's a new pain management specialist that we have brought in. She is here in Conneaut on the 2nd and 4th Mondays of the month. She does clinic, I believe, in the morning. She sees patients, and in the afternoon she does any pain procedures that might need to be done.
She did several yesterday, or
Did she?
on Monday, actually.
Monday, okay.
Yeah.
She is also in Geneva, so when she's not here in Conneaut, she is practicing in Geneva. So, the 2nd or 4th Monday, you're good to see her here. I am going to give you a number for her office too, and all of these physicians, I'm gonna give you a number for every office just in case, and I believe that they'll put that up on the screen for us, correct?
Yeah, that's what has
Okay.
happened, is that the number should float at the bottom of the
Okay.
screen.
So if you're interested in contacting Dr. Beck's office for an appointment for the next time she's here in Conneaut, or, well, it's already December, we're probably into January already, but the number would be 440-415-0138, and that's for Dr. Beck. The other new physician that we have brought here and is based here in Conneaut, which is we are so excited to have, is Dr. Maroon Mata, and he is pulmonary critical care. You want to talk about him a little bit?
Well, that's a very big deal for us. Obviously, it's huge, because we haven't had pulmonology in our town up to this point. Actually, Dr. Mata is going to be the guest on the next
Oh, yeah, that's
program
right.
that we have.
Yeah.
And so, yeah, after the first of the year, that'll be airing, and
Okay.
people will get a chance to hear him in his own words.
Right, we don't want to steal his thunder.
And what his background is and what his interests are and so on. I will just mention one thing that to just kind of tweak people's minds so that they recognize it when he comes on. Several months ago, Dr. Luis Argoti Green, who is a thoracic surgeon based out of UH Geauga, was kind enough to come out and do a program with us. And just a lovely man and an excellent surgeon. And he was very excited about Dr. Mata's arrival here, because what's going to happen is that the standard of care for lung cancer is going to sharply improve. There are studies that are indicated now and ways of assessing high-risk patients for lung cancers that are found when they're very, very small. And that means they're very, very curable. Lung cancer is one of those things, once the cow gets out of the barn, it's very, very tough. I mean, but if you can catch it early enough, it is curable. And that is going to be happening here. That's going to be available to our town. Dr. Mata and Dr. Argoti Green are going to work together. As a matter of fact, they're going to be together on one of our upcoming segments to discuss this further. And that's just one aspect of what Dr. Mata does. So he'll introduce that on the next show. But this is a very, very big improvement to the depth of our staff here at this hospital.
That was actually one of the things I was going to bring up, and now that you're mentioning the lung cancer screenings, I'll touch on it now since it makes sense here. But there is a lung cancer screening program that is done through CT that will give you advanced warnings of lung cancers. There is certain criteria that you will have to meet, but Medicare and most insurances will completely cover this screening as long as you meet this criteria.
And they're not doing it because they're nice guys.
Right.
They're doing it because if you can prevent a lung cancer and catch it early,
Yes.
it's going to cost them a whole lot less
Right.
than if you have to treat one.
Right,
I'm
right.
just saying, folks.
Yeah.
That's
So
life.
to qualify for this, and this would be something that you could talk to your PCP about, or if you do have a lung doctor. Men and women between the ages of 55 and 75 qualify. If you have smoked at least 1 pack a day for 30 years or more, or 2 packs a day for 15 years, you quit smoking less than 15 years ago. But you must not be already currently showing signs of lung cancer to qualify for the free screening. It's a very simple screening, does not take long to complete, and
Non-invasive.
non-invasive.
You don't
and,
get poked.
and can, and that's a bonus, and can just be a relief as well.
Oh, huge.
You know,
Here's people, and they know that people are not stupid, okay? People know, they hear what's going on in the culture, they read things, they know if their risk for lung cancer is high, okay, or higher than the average. And here they get a study and they're told, no, absolutely, categorically, you don't have it.
right,
What's that worth to you, to know that?
right, and it's free. So you do need an order from your primary care doctor. So as I said, this would be a conversation that you have when you go and have your annual visit with your doctor, and maybe they schedule your colonoscopy, they schedule, your mammogram, whatever your annual screenings are that you perform. This would be one that if you feel like you qualify based on that criteria, that you would want to talk to your physician about as well.
Yeah, your doc will probably bring it up, but if they don't, you bring it up.
Right.
You bring it up and ask them specifically. I heard about this lung cancer screening. Is that something that applies to me? And they'll take it from there, okay? Because they'll know your history and they'll plug you right in. So, but just if it's not brought up when you visit your doc, bring it up yourself.
Right.
And that's for ages 55 to 77, right?
Correct.
Okay.
Right. And again, that's empowering. It's taking control of your health.
That's right. That's right.
Dr. Mata, again, he is here in Conneaut. We built a new office suite for him. I don't know if have you walked through that new office?
Sure.
It's very nice.
Oh, it's very nice.
Very nice. He is actually on the second floor, just right near where the Ohio Bone and Joint is, in between Ohio Bone and Joint and cardiac rehab. So he's up there on the second floor. His office number to schedule an appointment if you're interested in seeing Dr. Mata would be 440 593-0197. Couple other, well, actually, one other new doctor I want to talk about, Dr. Turker Yilmaz.
He's been a guest.
Yeah. Oh, yeah, that's right. He was a guest too.
He was a
Yeah.
guest too,
And
sure.
I think he'd like to come back on again. I think he wants a do-over.
Oh, no, he did a great job. But
Yeah.
what I told him after his last appearance was that we were planning on having several more appearances by
Right,
him.
right.
And so he'll be coming up within the first few segments
Mm-hmm.
after the first of the year.
I think the great thing about that is when we bring new physicians in, you bring them on as a guest, as an introduction, but as they get to start seeing patients in the community, they get a better feel for what the needs are in the community. So they
Exactly.
can come back on and talk to you a little bit about, you know, these are the things that I can help with. These are the things that I'm finding are an issue, and I can help take care of this. So
Exactly, right.
yeah, so again, Dr. Yilmaz is an ear, nose, and throat doctor based out of Ashtabula, and his office number is 440-214-8005, and he does see adults and children.
I think it's very important to emphasize that. I was surprised, I did not realize that when he came on
Yep.
the show, that he's actually done a pediatric fellowship. So he is specially trained in ENT issues for kids,
Right.
okay? And that's, it's really nice for us to
Yeah.
have that in our town, have access to that kind of expertise.
He does have an audiologist there too that is with him a couple days a week, and so if someone is coming in that they already know will be predisposed to needing a hearing screening, they try to make sure that they schedule you so you come that one visit. You come and you see him, and you have your hearing screening. You're not having to make two separate trips back in. So
That's nice, that's very nice.
yeah, so that's something. And one thing is, you know, typically 6 months and over is what he tends to see. But if there is a newborn and it's been identified, if a parent feels that there is a hearing issue, he will see infants and babies, and there's no really limit. He wants to be able to help identify things much sooner than later.
Always
Yeah.
a good idea to do that.
And not that Dr. Kumar is new, but you know, he's been here a little over a year now. He has gotten, and I just want to mention, he's just gotten much more involved and hands-on with the resident program here at the hospital too.
Which I hear very positive things about.
Yeah,
He
he-
really teaches.
Yeah, he has been a phenomenal teacher. He still is at Conneaut Primary Care, accepting new patients still. So if you're looking, you know, if you're considering a new primary care doctor, please do consider Dr. Kumar. And
I've had several patients who've come through my office who didn't have primary care doctors. And I suggested that it might be in their
Yeah.
interest to have one. And so they've, a lot of them have gone to see Dr. Kumar.
great.
And I hear back from them that one of the things that they really appreciate is how thorough he is. I mean, he'll go through their whole medication list, which hasn't been tampered with for years, and he'll say, no, maybe, and he'll change things around, take them off a bunch of medications that they don't need. That's very proactive,
It is.
and patients like that, I like that when I see
Right.
that. So the feedback I'm getting is that people
Good.
feel very safe with him.
Good. Well, if anybody is looking for a new primary care, you can call his office directly at 440-599-7466. And Sharon or Lisa, whoever might answer the phone, will be happy to schedule an appointment
That's right.
with Dr. Kumar.
That's right.
So those are where we're at right now for new physicians. I feel like we've come a long way in the last year and a half. Don't you think? I've been talking a
absolutely.
lot about new physicians that we're bringing on.
You know, and we did, I mean, I'll just mention, you know, Susan Rattay's over in Ashtabula.
Yes.
And along with Courtney,
Yeah.
over there in that office.
Yes.
This is, you know, Denise didn't really bring this up, but I just mention it, you know. That primary care practice over in Ashtabula, we had UH physicians who were coming in to staff that, but we were looking for somebody, you know, permanent to do it. And Courtney Baruso came in, and her partner Susan Rattay are now in Ashtabula, And they're at AMAC, right?
Yes, yeah, they're on Lake Avenue,
Okay.
at the Lake Avenue
So
Health Center.
that's actually, it's not actually the Conneaut, but those are physicians that have
Yeah.
been brought into our county.
Well, and Dr. Barroso does cover patients 1 weekend a month here in Conneaut. So if something were to happen and you would be admitted and, you know, maybe you don't have a primary care doctor and you may have the opportunity to meet Dr. Barroso and maybe get on her schedule. They are really there, they have so much energy, which is really exciting. And I've heard really, really fantastic things about patients that have actually switched to them.
Well, you know, when Anil Patel so unfortunately passed away, that was a huge practice that he had.
Yeah, it's a big
And
loss to the community.
And a big loss to the community, and those patients felt shipwrecked. I mean, now what?
Mhm.
And so that's why it's so encouraging, I think, to the town to realize that very important practice has this level of energy and this level of commitment now.
Mhm. And Dr. Rattay is family practice, so that means that she can treat an entire family. She can see children, grandparents, parents. She runs the whole spectrum. The benefit to that is you know a family's history. You may know what a family might be predisposed to, and you might be able to catch things sooner, whether it be high blood pressure or diabetes or you know, anything that might impact the entire family. So she's a great resource. You know, she's just been phenomenal. She also works with the resident program, actually right out of Richmond. So another person that we have around that's very good at teaching. All right, moving along. So much great stuff, right? Yeah. Another screening, so I touched on the lung cancer screening. Another one that UH has recently revised a little bit, and UH is actually offering this free to patients that qualify, is the cardiac CT scan for calcium scoring. And what this will help detect, it is a non-invasive CT test that will help early detection of coronary disease. And so the physicians all in this area do have the guidelines, and they know, but basically to qualify for this no-charge screening, and this is different than the lung cancer screening, but to qualify, it's for men 45 or over, or for women that are 55 and over, with one or more of the risk factors. You smoke cigarettes, you have hypertension, type 2 diabetes, possibly a family history of chronic heart disease, and or you're 40 and older, maybe you've been diagnosed with irritable bowel distress or lupus or rheumatoid arthritis. So if you qualify for, if you have a risk factor that falls into that, you're gonna wanna talk to your physician about whether they think that this free screening may be something you should pursue.
Absolutely. Well, again, it's one of those things that you can get a jump on a very, very common disease process, still the #1 killer in the country. Cardiac deaths going up, actually not going down, and this is a very sensitive test. It gives, like I say, it's non-invasive.
Mm-hmm.
You don't have to do anything, you just go into the CT scanner, and it can actually see if there's calcium deposits in the arteries to the heart.
Mm-hmm. Wow.
It can actually see that, and accurately, and that will set you up to be able to take the kind of preventive action that you need to not wind up finding out you have heart disease when you have a heart attack.
Right. So, and that only takes 5 or 10 minutes. It's a very, very easy screening. So I'm going to kind of switch gears now a little bit more to some of the things that we're doing in community outreach. So some of you may be familiar or have heard about the Walk for the Cure that UH Geneva Medical Center has sponsored for the last 15 years. It originally started as our Komen Walk for the Cure, and we had a grant from Komen that allowed us to provide free mammogram screenings to the community. And it was based primarily out of Geneva because that's where the grant was written. Well, over the last 3 years, Komen has, you know, like many other organizations, has had to really kind of funnel their funding to specific organizations. And unfortunately, we were not able to continue to receive their grants. However, we continued to do the walk. So through this Walk for the Cure that we do every September, and it's done through my community outreach department, we've raised anywhere from $13,000 to $20,000 a year. What we use that funding for is to provide free mammograms for underinsured or uninsured women and men who may be at risk for breast cancer or are of the age 40 to start getting their annual screenings and just cannot afford to do so. Because we are not under the Komen grant for just Geneva, we are bringing this program to Conneaut now. So January 16th will be, it's a Monday, will be the first time that we are here offering the free mammogram screenings. There will be some additional flyers that we'll put out. We'll promote it in the newspaper as well. But typically what this involves is two of our outreach girls. One is our breast navigator, and the other is actually a breast cancer survivor and the chairman of our walk, and also a nurse on the floor in Geneva, will meet with you, and they'll do some education. You'll have to fill out some forms in advance to make sure that you qualify for the free screening, but they'll do some education, and then one of our nurse practitioners will do an exam, an actual physical exam, and then you'll be taken.
Hold on.
Yeah.
The fire alarms are now being serviced. We have your attention, please. The fire alarms are now being serviced.
We can edit that out.
Yeah,
Yeah,
and then they'll take you to radiology to get your actual free mammogram screening. I have to believe that there's a need for that out here in the community that we just don't know exists yet.
Yeah, and part of the problem is that it's hard to find out that it exists because the
Right.
people who really need it rarely come in contact with the health system because they can't afford it.
Right.
So that's, I think, one of the benefits that the Cable Advisory Board of the City of Conneaut was looking at when they wanted to keep this show going, because people watch this show, they hear about this, they realize, gosh, there is a program for free breast cancer screenings. Just because you can't afford to have a mammogram doesn't mean you can't get one. And now we know that there is a way. People are going to hear about it. So if somebody hears about this, is watching this and hears about this and decides, gosh, now I have a chance to get a mammogram, what should they do?
So if you want to find out if you qualify, I'm going to give you two phone numbers that you can call either one. If somebody doesn't answer you, they'll call you right back, leave your name and your phone number and what you're interested in. You will be calling either Lori Slimmer or Paula Koval. They're both community outreach nurses. So the first number is 440-998-0695. Or your other number would be 440-998-0680. They'll call you back. So I recommend, leave a home number or, the best number to reach you at where, you maybe can spend maybe 5 or 10 minutes on the phone, because what they're going to do while you're on the phone is just gather some preliminary income information from you that is required, that we have to provide to make sure that you can qualify for the free screening. Why that is important. If we do the free screening and we detect that there is something that needs further diagnostics, if we have not qualified you income-wise, we don't have anywhere to send you to help you get your rest of your care paid for. So that is the important piece to that.
So the hospital is working to take care of that up front,
Right.
so that you're not sitting there with a positive mammogram
And have nowhere to go. Right.
That's really
Yeah.
important.
Yeah, and fortunately, Seidman has been a great partner with us. We have two resources, one out of Lake County and then also Seidman, that will help with any additional diagnostic testing that might be needed or cancer care after that. So please call one of those numbers if you're interested. Again, the next quarter, we're going to try to start doing these quarterly. The next one will be January 16th, which is a Monday. We will always do it on a Monday because that's when our nurse practitioner is available. She's also here doing infusions So we've got her on hand to be able to do this, and it will be done in the morning hours. But Paula or Lori can share all of the details and the information once we find out if you qualify. So I'm actually very glad we can bring that to this community.
Absolutely.
So some other new community events, and I'm going to kind of go over these probably pretty quick. We're probably running out of time.
Yeah.
I kind of talk a lot.
Well, that's all right. It's important stuff.
Some new community events that we've got going on. We've added 2 new support groups that our team has involved with other resources in the community. So we started a weight loss support group at Snap Fitness in downtown Conneaut. They've been fantastic to work with. Right now they meet on Mondays from 6 p.m. to 7 p.m. After the first of the year, they're switching the hours to 8:30 a.m. to 9:30 a.m. If you are interested about becoming part of that weight loss support group, stop by Snap Fitness and they'll be able to give you the information for that. They've been a great partner. They want to see everybody in the community make changes as well in their health. We also started a diabetes support group, which meets the 3rd Thursday of the month at the Conneaut Human Resource Center. That meets from 10:30 to 11:30. If you're interested, no need to call, reserve a spot, just show up. We have about 15 to 20 folks from the area that come every 3rd Thursday. Some of the things you'll learn there is about, we don't really dictate it because it's a support group. We want the people who are coming to be able to share their own stories and find ways to help support each other. So, but we will bring healthy cooking tips. We may do some cooking demonstrations. Some people are still struggling with being able to monitor their sugar levels, so they share ideas on that. We may bring in we have a clinical pharmacist on staff who is fantastic. She loves to go out in the community. If we find people are struggling with that aspect of it, maybe she'll come out and talk a little bit. Maybe they're struggling with how to pay for that medication. Maybe she'll come out and say, here are some resources that we know about that can help you pay for your diabetes, your insulin or whatever the case might be.
That's great.
Some other health education, just real quickly, we're still at the Conneaut Human Resource Center every month doing our health smart talks. We now call them the Lifelong Health Series. They've had a variety of different names over the years, but we still are continuing to do that. We have started a new leaf, now has the new leaf out here on Route 7, has the Ashtabula YMCA doing a Silver Sneakers program out there, and the Ashtabula YMCA we're very active with in Ashtabula. So we're also coming in to the one here in Conneaut and doing the health lectures and doing health screenings periodically as well. We've expanded our community outreach efforts too into Albion, Fairview, and Girard, as well as Andover.
Wow.
One of the things that's exciting about Albion, Fairview, and Girard is we've not ever ventured over the Pennsylvania line, but we're finding that the senior centers there, the folks are so excited to have us come in and hear about different health topics, whether it be diabetes or how to cook smart, or even simple things like winter safety tips. We've had 40 to 50 people come to these senior centers to listen to us. So
that's great.
Yeah, we're really excited to be able to bring that free to the community. We're going to continue. This year we did our annual health expos. We do one in May, we do one in July, we do one in November. We base them in the Ashtabula area. That way our folks from Geneva, it's halfway for them. Our folks from Conneaut, it's halfway from them. We bring in physicians to speak. We provide all of the screenings and activities and everything you get that day for free. What we want you to walk away with is tips on the ways that you can help improve your life. So that's why we feel it's important to bring those events to the community. Some new programming actually we're looking at for 2017. We want to bring in a Matter of Balance program out to the Conneaut community, and it's actually an 8-week program. So we're trying to find a venue where we're able to do that for 8 weeks.
I don't know how to turn this darn thing
There you
on.
go. Hang up on him, that works.
I didn't recognize the number, so.
So the Matter of Balance will help with falls prevention, but it's a evidence-based, it's a fantastic program, so we're looking to bring that in, as well as a chronic disease management program, which will also be an 8-week free program. But one of the key things about this is it encompasses everything, and it also helps identify if people are at risk for pre-diabetic stage, or being a pre-diabetic versus addressing it once you're already a diabetic. So those are just a couple of new programs that we're hoping to bring into the community this year, in addition to what we're already doing. We are also planning on expanding our life skills program in the Conneaut schools. They really want us in their third grade as well as their high school. We're already in the middle school. So, and that's bringing education to the youth. So it's part of our community outreach efforts. And again, this year, some of the things that we were just involved with that we love is D-Day. We have a huge presence at D-Day every year with our medics, our EMS, our nurses, our physicians. We're there both days in full force. The 4th of July parade, we participated in the community block party that Good Shepherd put on for the first time this year. We hope they do it again next year. It was fantastic. And then Conneaut Arts Center, we participated in their art camp this year with physical activities for the kids. So there's a lot going on, a lot.
Well, yes, obviously, I think it demonstrates the level of commitment that our hospital and our medical community has to our greater community.
Definitely.
Doc, you and I have been doing these shows for going on 8 years, I believe now.
Yeah.
And over that period of time, we have seen so many great advancements, like Denise has showed us today, that have happened for the positive for this town. And I think we should be very blessed. We are very blessed, and we should be very grateful that we have UH Conneaut Medical Center here in our community. It's a very big asset for our town.
I agree. I would certainly guess that there aren't a lot of communities our size that have this kind of expertise and this kind of depth in the healthcare resources available to them. It doesn't happen, and I think that sort of demonstrates that UH is willing to put it on the line.
Absolutely.
Oh, definitely.
Well, gosh, Denise, we really appreciate you taking the time to come and
Oh, I love
tell
coming
us.
on here.
This is just amazing to hear all of this stuff. You kind of see it, but when you hear it all at once, it's like, wow.
I know. When I sit down and I write this year in review, I'm like, oh, no wonder I need a vacation. There's so much going on.
There's
It's
so much
fantastic.
going on. It is fantastic.
Yeah.
All right. Well, thank you very much.
Thank you for having me again.
Absolutely. Thanks for coming on.
Yeah. Happy holidays to everybody.
Same to you.
Thank you.
And that'll do it for today, and we'll be back next week. Have a great holiday.